My name is Robert McCririck. I graduated from Queen Margaret University with a BSc Honours in Podiatry in 2013, and today I am a senior lecturer with the Sports Medicine Ultrasound Group, and I am the founder and lead podiatrist here at Tweed Podiatry. So I started by immediately signing myself up for a master's degree with Queen Margaret after I graduated because I wanted to stay in touch with the place. And my first job clinically was with the NHS in Tayside. After about 4 years of working with them, I immigrated to Canada for a wee bit. I then got homesick and came back to the borders. I was initially working up in Edinburgh doing private practice, some sports medicine stuff, and got some lecturing work back at QMU. And then I thought after about 5 years having graduated, it's maybe time for me to strike out for myself. And that's when Tweed Podiatry was born. Podiatry is an incredibly broad career. We are the specialists in foot, ankle and lower limb care. So we take care of all sorts of issues related to structure and function of the lower limb. And with that, there are loads of subspecialities, and therefore it can be a really rewarding career for people with interests in all manner of areas of medicine. Podiatry is a very rewarding career all round because you get to have a direct impact on the ability of people to move more comfortably in less pain, and it's also a career that offers a great work-life balance. Podiatrists generally work 9 to 5-ish kind of hours. We don't tend to do a lot of weekends. We definitely don't do night shifts. So it's very sociable hours. It's a fairly well remunerated job, and especially as you're sort of further into specialist practice. There are lots of opportunities for podiatrists. It's a very varied and rewarding career path. Your big ones being the private sector, the NHS and academia, but within those you've got subcategories of specialisms that you can do. You could train to be involved in rheumatology and diabetes, pediatrics, orthopedics, biomechanics, you can do diagnostic imaging, the list goes on. So there's a lot of really interesting and gratifying subspecialities that you can branch into. Yeah, it was obviously very intimidating starting out my own practice, but I have been very pleasantly surprised since day one. The support that we've had, not just from the members of the general public, but from other healthcare practitioners in the borders, has been astounding. So we've built some really strong professional links, and some really good referral pathways back and forth with each other. And that's been to the betterment of everyone, I think, other practitioners and of course the patients who come to see us for care. So what QMU definitely gets right is their balance of the theory and the practical involved in the course, because although we are kind of knowledge workers, we need to have a strong knowledge base of different medical conditions and so on for the problems that we see with our patients. You also need practical hands-on skills to apply that knowledge and make a difference for people. And I think QMU does get that balance right, and I think they also are very good at making sure students are exposed to clinical practice and placements very early on. So you get a really good idea early on if it's the right career for you, and you get lots of experience. So by the time you've graduated, you are, as far as I'm concerned, ready to hit the ground running.